talked about such things, and we've advised them as the health. So when one of a couple is diagnosed with TB, so what they advised is that yes, for sure they should not use the same bedroom. Okay. So what we advise them is, at least for the why is it like this? So the infectious rate or infectiousness reduces. So by the time they will be clocking 2 weeks on medication, you find that even the load is reduced and they are not as infectious as they were initially. So they can rejoin their spouse after 2 weeks of being on treatment, so that they reduce the risk of transmitting the TB germ to their partners or to their spouse. Yes, so if you remember so well where we came from, initially it used activities and so on and so forth. There's no need of you admitting me.
Okay.
I've already exposed the input on treatment, the load will be reducing slowly by slowly. But remember, this is an enclosure, it's a room. Someone is put on treatment. We understand so well that when you are put on treatment, yes, there's the microbiology part that plays, that takes part and so on and so forth. So you find that it even increases the risk of someone getting the TB.
What will happen on the 24th of March? What have you put down as a program for this day?
Okay, so very important also. So like Bishop Ondrogo stated in the opening remarks, so 24th March of every year, worldwide, we commemorate World TB Day. Okay, so we commemorate World TB Day. So this is a day that we want to make use of, so that in our activities we want to spread for people that may have the symptoms of TB. We want to follow up on those, like I said, contact tracing. We want to put those risk population testing in people that have TB because of the co-infection between TB and HIV. So those are some of the activities that will be ongoing during our commemoration. So we'll have our commemoration on Thursday, just a day after tomorrow.
Yeah. What do you feel about this theme? Are you asking people to support Minister of Health in which way? And so what are you saying to the public through the theme?
Okay, so our theme for this year is invest. And so we have a TB end strategy by World Health Organization, which we should be able to end TB by 2035.
Okay.
So this is just 2022.
How do you hope to achieve that?
So how we hope to achieve that is through community engagement, partner engagement, and not just MOH working as a standalone. No, we can't fight. We can't fight TB alone. So no, yes, like because of the way it is spread, it's an airborne disease. You don't pay particular attention to the person who has TB, then the spread is will be continued. Remember, we were talking about TB and men. So it is one way of saving lives.
Okay.
We want to end TB. We know they have the poor health-seeking behaviors, and we go out there to, if they have the symptoms of TB as quickly as possible, they go to the health facilities.
3 years. How has it been?
Okay, so in the past 3 years, district, so I'm talking at district level now. So in the number of partners that we've had at district level, you'll find that we have quite a number of them that are helping us in the fight against TB. So we are doing activities that we are able to catch TB at community level, at facility level, and so on and so forth, because of the enhanced kind of approach that we are using. So we are able to identify a lot of TB cases which we were missing previously when we were just looking at MOH with our partners because of constraints in resources. But now where we have partners, they are helping in such, and because of that, we've seen that our numbers have gone up. And if we diagnose more of the TB cases, we know it's curable, and we don't miss TB cases. So the impact will be shown, it will be seen in such a way that most of the people, because they'll be on TB treatment, so the burden will be reduced. So in some 2 years to come, you'll find that the graph now will start coming down.
Okay.
Yes.
Okay, so there's
then,
hope.
Yes, there is.
That
Yes,
the
for as long
graph
as
will
we
start
fight the TB
Yeah.
together, then we'll end TB by 2030.
All right, but how are we doing as Mazabuka?
So doing as Mazabuka, okay,
Yeah.
we still have a lot of work to do, especially in our communities. Yes, we've reached out to our communities through, yes, like this platform. Then the other platforms like the radio programs that have been ongoing. Then also with the community sensitizations through our peers from different facilities. But then we are not saying everyone has been reached out to, because if you had a random selection of people to ask if at all they understand TB, you find that you'll be surprised to find out that some of them actually don't understand what TB is. So we want to make sure that almost everyone in Mazabuka understands what TB is, just the way we understand COVID. Because even a small kid will be able to tell you what COVID is, as young as 2 or 3 years. But yeah, this is a disease that just came in like 2-3 years ago. But we've been with TB for quite a long time. So we want it to go to be known actually by almost everyone. So that's the step we want to take also. We want to sensitize our masses on what TB is. And we are requesting our viewers, those that have been with us from the time we started, please, you be our ambassadors. And
well, is it in the urban? And do we have specific areas where you feel it's concentrated? Yeah.
Okay, so you'll find that lots of TB cases are found in urban areas. It could be because of the activities that are ongoing. Okay. So the pollutions, the lifestyles, the overcrowding. Almost everyone is moving from the rural. They are coming into town. And because of that, there's overcrowdedness, there's congesting with poor ventilation and so on and so forth. So you'll find that we have a lot of cases. As whoever walks into the facility with or without symptoms of TB that have been presented, you ask so that you know whether they have them or they don't have them.
Yeah, sensitizing people. I have seen, sometimes you find people are spitting in the street and they're coughing, they do not take care of the cough, their mouths when coughing, and so we have such things. For sure, like you said, we need to work with other stakeholders, maybe even law enforcers, to just ensure that some of these things are taken care of. I think that's the way we shall win. Now, what would be your last words in terms of